Ghana will start manufacturing tuberculosis and malaria vaccines by the second quarter of next year. Speaking at the launch of the short course in clinical research methods in tuberculosis in Kumasi, the Presidential Advisor on Health, Dr. Anthony Nsiasare, disclosed the vaccines will be produced at the National Vaccine Institute to improve the health system.
Dr. Nsiasare also mentioned that the European Union has supported Ghana with 32 million euros to produce vaccines.
We realized that during the COVID vaccines period, we had a lot of problems of COVID, of a vaccine, geopolitics, nationalism, and we didn't, even though we want some, we didn't have. So we decided that we shall join the Pan-African Vaccine Manufacturing Initiative, and Ghana will be a vaccine manufacturing hub in Africa. And God being so good, there are two factories. One of them is finished, and as we speak now, the processes of manufacturing or doing fill and finish for anti-snake vaccines is ongoing in one of the plants as we speak now. The other one has come out of the substructure, and we are hoping that by second quarter of next year, it will start producing at least fill and finish, and then from the upstream to downstream, its own vaccines. And TB vaccines will be one of the vaccines that we'll be producing in Ghana. The good thing is that we shall also be doing fill and finish, and also the drug product, and then fill and finish for the endemic malaria areas for the new for the new R21 malaria vaccines in Ghana.
The short course in clinical research methods in tuberculosis is an initiative by the GlaxoSmithKline in partnership with the Kwame Nkrumah University of Science and Technology. The course is expected to build the capacities of young researchers and guide them in asking the right questions to combat tuberculosis. Pro-Vice Chancellor of KNUST, Professor Ellis Osudabo.
And it was clear in some of our regions across the country, many of our pregnant women had TB and did not know. The infection obviously is rife and amongst us. All you need is a certain predisposition that reignites the disease. Those predispositions are well documented. Poverty is only the epitome of those precursors that I was talking about. A person who is poor will not be able to afford good nutrition, and therefore would result in one of the precursors to pulmonary tuberculosis.
Vice Chancellor of the Kwame Nkrumah University of Science and Technology, Professor Mrs. Rita Kusia-Dixon, encouraged the participants to forge strong networks. Reporting for Joy News, Kwesi.